We're going to be talking about fetal monitoring in special circumstances. And every session we're going to talk about something slightly different over the next, say, 5 or 6 sessions. Okay. I think the one that we're going to be starting with today, given how important it is Pyrexia and Chorioamnionitis. Yeah? Okay. So when we're considering anything about special circumstances about fetal monitoring, the main questions that we have to ask is, okay, we have a finding of some sort or have a specific condition. How do we diagnose it? How do we know that that's there? Why is it happening? Is this affecting labor in any way? Is labor affecting it in any way? What effect it has on mom? What effect it has on baby? Simple. Very, very easy. But it's general broad lines that we think about with anything that has to do with medicine. Yeah? Okay. So that's the same way. Pyrexia. Temperature of 37.8, yeah. What? Any other levels, cutoffs? 38. So the reality is there is no actual definition for pyrexia. Okay. We are lucky within the UK. Most units agree that so it's more than 37.4 twice. Okay. Or more than 38, even if once. That's what we define pyrexia as. Where does this 37.4 come from? I'm not entirely sure. There is no actual evidence of what makes 37.4 much more important than 37.5 or 37.6. Okay, so that's how to diagnose it. We've measured the lady's temperature and we found that it's more than 37.4 twice. Okay, so what causes pyrexia in labor? Why would a lady become pyrexia? It's an infection. Yeah.
It's the environment.
So the heat around. Okay.
Epidurals?
Epidurals. Yeah. So that would come with infection. Okay. What about ladies who are being induced? Prostaglandins that we give. They cause a bit of a temperature. Okay. The fact that she's pushing, doing that exercise, that's a lot of effort. The temperature goes up just because they're doing that amount of effort, especially if they're pushing with the sun shining at them with very little ventilation of the room. Yes? But yes, warm environment can really, really affect the temperature. Okay. But why is pyrexia important? Who cares if her temperature is 38 or 39? Hello. So this video just demonstrates how much time I have on my hands. Probably I'm underworked at this hospital, which is why this is what I'm doing. So our brain is formed of lots of fats and proteins. So what you have here is just egg white, albumin. And what I'm going to do is I'm going to put in a warm bath and measure the temperature and just observe it for the coming few minutes. And I'm not entirely sure about the light. Can you see this clearly?
Yeah.
It's clear.
Okay.
Yeah.
You'll start seeing it once the steam moves away. So we're at 22 degrees at the moment. Okay. Now remember, this is just being heated from all around. But obviously the hottest part would always be the periphery. Okay. That's why the temperature is actually measuring the periphery, not the center of the fluid. We're up to about 25 here now.
Is
yeah?
that a thermometer you have?
That is a thermometer
Okay.
there. It's an electronic thermometer.
Nice experiment,
It's just I have too much time on my hands. That's the point.
We need to sort that out.
Okay, so we've reached 29. Still looking clear? Absolutely fine. Can anyone see anything alarming? All good?
It's egg white, you said.
It's egg white, just albumin.
Proteins. Yeah, building muscle. It's good.
Yeah. Remember, baby's brain is made mainly of protein and lipids. So the whole point about proteins is just to see what happens to them in temperature. So we've reached 36 degrees, if I can see correctly. Okay. Now watch. Do you see where the arrow was pointing? Just the periphery of the glass. Let me point again with the mouse. So look around here. We're just approaching now, going beyond 38. Can you see that white rim appearing? Okay. I'm going to go a little bit further. So now we're 39. I think the white rim is showing even more. Can you see that? Okay. So above 40 degrees, everybody's agreed this is called hyperpyrexia. Okay. This is very, very serious. Can you see the white now? What's actually happening here? What's happening to the protein? Nature. It's basically breaking apart. It's forming and it's causing. It's not the complex protein molecule that the baby can use and be helpful, but it's actually becoming denatured. And if you leave it for 5 minutes, so now the heating is stopped, it's just maintained at 40 degrees for 5 minutes. That's what it looks like. And at 10 minutes, that's what it looks like. Okay, so let's ask the question again. Why is pyrexia important? Because the protein denatures with the heat. Okay, we've all heard about the heat strokes that happen to people just in a heat wave. And we're talking about the temperature rising to 36, 37 degrees when there's air all around you. You can actually get rid of it. Okay? How long can you leave the temperature to be raised for? Can you give me an answer?
Well,
That was 10 minutes at 40 degrees, yes.
for now.
So, well, is that practical? Are you really going to reach everybody to treat them within 10 minutes? Oh, okay. So when you're thinking about it, remember that baby's temperature, so baby doesn't have the cool air circulating around. So baby's temperature is 1.5 to 2 degrees higher than mom's temperature. So if you're measuring mom's temperature at 38, baby's temperature is 39.5 to 40. The 37.4 that we're measuring twice, baby's temperature is about 39. Okay? Now, we said that the most common cause, or the cause that we're most scared of, is sepsis. So sepsis is actually starting in baby. That means that baby's temperature is raised much higher than mom, and it's only after mom is starting, the infection is spreading to mom, that the mom's temperature is going up. So that means baby's temperature is much higher. It's not just about 2 degrees higher, it's actually a lot more than that. Okay. So always think about, well, if mom is pyrexial now, how long has baby been pyrexial for before this is all presented? Okay. Now, the other issue is that sepsis and pyrexia damage the brain in different pathways. So the fact that the mom has a temperature can damage baby's brain, can cause denaturation. Sepsis has an entirely different pathway of damage, and they work together and they have a much bigger damaging effect on baby. So even if it's just about the pyrexia, control it. Okay? How do you treat pyrexia? Well, the only one we're measuring is mom. We're not measuring baby's temperature. So how do we treat mom's pyrexia? Say it again.
Treat the underlying cause.
Treat the underlying cause. So if she's in a hot environment, you can cool her off.
Yeah.
But if there's sepsis, starting from baby, can you treat that?
For baby.
If it's chorioamnionitis, then no, we can't really treat chorioamnionitis. The only way is delivery. You can get baby out sooner. So, but the temperature within mom, remember, the temperature itself is damaging. So she might have had a temperature because she has an epidural. She might. So paracetamol is an antipyretic. It resets your brain centers and it brings the temperature down, makes the body cool itself back down. So paracetamol definitely brings the temperature down. Would you give it oral or would you give it IV? Quicker. Okay, so that's it's more effective. And there is mom is not absorbing from her stomach in labor. Yes. Yes. Precisely. So it's gonna, even if she gets paracetamol now, that paracetamol is literally just sitting in her abdomen or her stomach for the next 6 hours.
Yeah.
It's gonna be very slowly absorbed. It may do some effect 6 hours later, and it's not gonna have the proper therapeutic effect that you actually get. That's why we get, and she might throw it up. Okay. But if you give it IV, you know it's in the system, you know you have a high enough dose for it to work on her. The other thing is that paracetamol does cross the placenta membrane. So it actually can go and help baby bring its temperature down as well. Does that make sense? So we said oral or IV. IV is definitely better. Do we have any other things that can bring the temperature down that we know of?
Cold environment.
Cold environment. You can put her in a cold environment. Cold
I
fermentation.
follow
Any other medication before we move on to other measures? Antibiotics don't bring temperature down. They treat infection, but they don't bring temperature down. Okay. What about non-steroidals? Do they bring the temperature down? Yeah? Okay. Do we use any non-steroidals in pregnant babies? No, we don't. Why not? So it can close the ductus arteriosus, may cause pulmonary hypertension. Okay, so we don't generally tend to use non-steroidals. What if we have a very high temperature and the lady is about to deliver right now, and we just need to buy half an hour to an hour's time? We need to start pushing and she has a temperature of 39. Can we use it then? How long does it take for diclofenac, which is the most common thing that we have non-steroid that we have on label wood, to actually cause closure of the ductus arteriosus? About 4 hours. Okay. Do we know of any other medication that we give that causes pulmonary hypertension? Betamethasone. And we give it left, right, and center. Betamethasone causes the highest significant pulmonary hypertension known for a baby. Okay, it's reversible, and but for that, so is diclofenac. And if baby is delivered within the hour or within the next 2 or 3 hours, it's going to close the ductus arteriosus anyway. So I'm not advocating using diclofenac left, right, and center, but I'm saying, okay, if the temperature is not coming down, we definitely need to bring her temperature down now. This is something that we can potentially think of. Okay, and yes, but we're not thinking about giving it and repeating it again in 8 hours. That's not our thought, because it will cause pulmonary hypertension for the baby. We don't want that. It's a last resort, if you would like to say.
So like just use it by next time.
Yes. Okay. We're fully dilated. She has a temperature of 39. Should I just leave her there and start pushing now, or should I try and bring this temperature down and then start pushing? Because it also has an anti-inflammatory effect. It stops the damage pathway from the infection a little bit. Okay, rather than having now temperature, infection, and hypoxia of the second stage all adding together. Okay, it also helps because it does cross the baby a little bit. It will bring baby's temperature down after delivery, so that helps managing the baby later on. Okay. Again, it's the last resort. I'm not advocating giving diclofenac on labor ward, left, right, and center. This is a very special circumstance.
So this is a very, very special circumstance that medicine. First line is paracetamol. Old midwifery care, in terms of, we had a heat wave almost a couple of weeks ago. The rooms on that side were extremely warm. I needed to move some patients this side, and we use these patches on the tummy and everywhere. I end up not being able to. We did deliver the baby anyway. So, and the registrar commented with me, the placenta felt like a heater.
Yeah, it would. Because temperature is going to be more than 42 if her temperature is 40.
And remember that when you have a high temperature, your metabolic rate is also higher. So the tissues, including the placenta, are requiring more. And more is food and oxygen. Yeah. So I would say paracetamol. Paracetamol, there's a limit of how much we can give. Think about the environment, especially in the summer, hot, and as a last resource.
And more importantly, think about when delivery is happening. Be realistic about your thoughts. If she's pyrexia, she's already developing temperature, and you're 2 centimeters and we haven't actually gone anywhere, well, are you really going to get there? Okay, so that's the most important. So consider operative delivery if you're not actually there. If you're just buying time, then You can use last resorts. Giving IV fluids brings mom's temperature down, brings baby's heart rate down for the duration of just having the fluids. So that's not a treatment for sepsis or for infection.
And I think that it's very good what Ahmed said, but and it's also important to say, is the pyrexia plus infection, or is this pyrexia because she had a nephew? Because you can bring down the pyrexia, and if it's only that is problem sorted. But if you have the cause of pyrexia is infection or chorioamnionitis, you are not sorting out the problem. Yeah, the problem is still there. So there's the inflammation pathway that is contributing to the increased risk of baby.
That drug you say you're going to give as a last resort. Why are you giving that?
The diclofenac,
Yes.
PR.
Yeah.
So just give a PR diclofenac. It works within the 5 to 10 minutes. And then temperature will start coming down, both moms and babies, within the next 15. Okay? So just looking a little bit closer about chorioamnionitis, because that's obviously, you just said that's the most serious cause of pyrexia. Yeah? So what's chorioamnionitis? Chorio and amnioitis?
Yeah.
Infection.
So fetal membranes, the amnion and the chorion, and it's usually due to bacterial infection. Okay? So the very important point that we talk about is clinical versus subclinical chorioamnionitis. What does that mean? How do I figure out infection before it ever happens? The problem here is, who are we monitoring while we're in labor?
Mum and baby.
Mom and baby.
Yeah.
Who are we measuring the temperature for? Mom. So if we're waiting for signs of sepsis to appear, which is tachycardia and high temperature,
Yeah.
so for clinical chorioamnionitis, that we're waiting for mom's temperature to go up. But who's the infection in?
Baby.
The infection is in the fetal membranes.
Yeah.
So basically, for the temperature to go up, that means we have enough infection to start in baby, to spread to mom. Sorry, am I going the wrong way?
And I found often that can be quite delayed. So
It will always be quite delayed.
Yeah, these women who you just know something's not right, but you're just waiting for the observations to make sense.
So the question to you is, how do you know that there's something that's not quite right?
I guess if the temperature's still within normal limits, but it's going up, so say you have 36.3, 36.7, 37.1, 37.3, okay, they're all normal, but if you can see that trend, then
Yeah,
perhaps.
that's a very good point. Okay, the problem is that trend can also happen just because of the effort of labor.
Sure.
Okay, so once again, this is an infection in baby. Baby is going to respond first.
You might notice
The heart rate will go up. So baby's baseline will go up. Okay, baby's heart rate will become a bit more tachycardic. What we used to call in the very, very old days, uncomplicated tachycardia. There is nothing uncomplicated about tachycardia. Okay, there is no reason for you to raise your heart rate with no cause. Okay, neither you nor baby. Now, having said that, remember that if baby is active, the baseline will slightly go up because your heart rate is generally a little bit faster than when you're asleep. So if you have a bit more of an accelerative baby, the baseline will be slightly higher. While if you have a sleepy baby, the baseline will generally be a little bit lower. Okay? Now, with the baby's temperature, if your temperature is going up, does your heart rate rise quickly or slowly?
I would say it's gradual.
It's going to be gradual, yes. It's not going to be just like I have a deceleration and then I have a rising baseline. That's not sepsis.
So it's not easy to because it's going gradually.
So you'll see it over, say, an hour or so, not over 5-10 minutes. Okay? So that's more about hypoxia kind of tachycardia. Because we now can see a baby that has a faster heart rate, and we need to figure out why. Does that make sense? So we need to find out why is this baby's heart rate going up. Because other causes of baby having a bit of tachycardia, I just said hypoxia, so that's one. Everybody talks about dehydration, no? No, dehydration, we don't live in the Sahara Desert. I come from there, but I don't live there anymore. Yeah? So what?
I just don't quite like it.
So it generally takes a little bit longer for the heart rate to go up. Not a fast rise. A fast rise usually comes with hypoxia, not with sepsis. But if you can see a gradual rise, and you can't explain why, there's no deceleration on the trace, that is sepsis until proven otherwise. Even if mom's temperature is perfectly normal, even if it has remained the same. Remember, the baby has to get infected, multiply the bacteria enough for it to spread to mom, and then her temperature goes up. Okay? Okay. So maternal pyrexia means that chorioamnionitis has spread all the way to surrounding tissues and it has reached mom. But if mom's temperature goes up first and then baby's heart rate goes up, that means it's actually mom's the problem. There's a problem there. So that happens with an epidural rise. That happens with a warm environment. Baby's completely fine. Mom's temperature is now raised and now baby's heart rate's gone up. So that baby had no clue until the temperature went up. Okay? And if there's an infection there, then you can potentially treat the infection because now it's a maternal infection. But remember, the temperature has to come down. Temperature is damaging within itself. Okay? So, can we treat chorioamnionitis? So, chorioamnionitis, an infection in babies' membranes, placenta. Can we treat that with antibiotic? No. So, the only antibiotic that was found to cross the placenta in dosages enough for a prophylactic dose, not actually a therapeutic dose, is the 1.5 Pyrexia IV. Okay, but that's a prophylactic dose, so we can't treat chorioamnionitis. So why are we giving mom antibiotics?
Oh.
For her. Just make sure that the infection that's now spreading everywhere, remember, she has bacteria going straight into her veins. We're trying to control this for her sake, not for baby. We're not treating the chorioamnionitis. We're just trying to make sure that mom does not become unwell. In very old textbooks, there used to be something called an extraperitoneal cesarean section, meaning that you actually even keep the mom's abdomen closed, as in the abdominal cavity closed. You peel everything away and you open the uterus outside the peritoneal cavity, just to try and avoid, it's a very damaging procedure, but it was written for chorioamnionitis. Okay? That's how serious they were taking chorioamnionitis. But the reality is, we're giving the antibiotics for mom, not for baby. Don't expect the antibiotics to bring temperature down, not because they don't. Okay, and if they do, something's actually wrong. Okay. So, the question again: how long can we leave chorioamnionitis there before we start treating? If we think that there's chorioamnionitis, how long can we leave it there, and how long before delivery?
Treat it within an hour.
So that's the sepsis 6 protocol. But you're 4 centimeters, 5 centimeters, you now think there's chorioamnionitis.
Depends on the rest of the story.
Depends upon the rest of the story. But just to put things into perspective, the reality is we don't know. Okay? So incidence of brain damage with just hypoxia is about 8 to 10 fold. Okay? With just the chorioamnionitis, 8 to 10 fold again. Chorioamnionitis and hypoxia together, 7 to 6 fold. So, are you surprised? Well, we now have temperature, we have an infection, we have the hypoxia on top. They're all three pathways of brain damage. So 7 to 6 fold damage to the baby's brain. That's why I was saying, do not leave the temperature high while getting her to push. Bring the temperature down. That's why the last resort of diclofenac. Yeah, does that make sense? So once again, there is no evidence to tell you exactly how long. But if you can see that somebody is progressing really fast, we're expecting within the next couple of hours, okay? The cesarean section would be damaging to mom. Not necessarily very helpful to baby. So just think about the full clinical picture. If she's approaching that, she's getting there, bring the temperature down, give antibiotics to mom to protect her, get this baby delivered safely. But if we're 2-3 centimeters, then no, this is an unrealistic expectation. You have to be very clear about your targets. Does that make sense? Okay. Will we go on to the case discussion?
Sorry, what did you mention about diclofenac? You mentioned
So, diclofenac is a non-steroidal obviously. It has a strong antipyretic effect, but we don't give it to pregnant moms because it causes closure of the ductus arteriosus, hence causing pulmonary hypertension. So we don't want to be giving diclofenac, although it is a very helpful medication to use if we have resistant temperature. Okay, so the closure of the ductus arteriosus, the pulmonary hypertensive effect of diclofenac on baby, works about 4 hours after giving it.
4 hours.
Yeah. So the idea is that you can give it.
An hour.
Yes, you're giving it just because I need to get this next hour just to get through.
Is 4 hours true for Remy? They're preterm, is it still 4 hours?
I don't have the answer to that, sorry.
Would you give it?
Preterm has a lot more problems happening. You need to think a bit more closely. Remember, they have more susceptible brain to damage. They have other issues happening. So if she has a pyrexia, we're talking about we're 4 hours from delivery, but she's been progressing amazingly well, potentially. Okay? So I don't have the answer for Frennies.